Some of our staff, our ambulance officers, experience violence and aggression as part of their role, sadly. And we like to provide a level of support following those incidents, encouraging them to debrief, to have a conversation with their managers, with peer support or other support provisions, and also to make sure that we track and support them if there is any further kind of criminal or court-related process, because that can be a really challenging time for our people. Staff that feel supported and cared for genuinely by the organisation appear to flourish and do better as an outcome of these really difficult times. So we find it really helpful to ensure that we have processes and policies around making sure we support people after a traumatic or distressing event. So we have a standard operating procedure within St John that has different criterion of a job that would activate peer support, for instance, and let a manager know that their people had been engaged in one of those jobs. Means that we're being proactive and we're giving people an opportunity to debrief, and we know that's really helpful in mitigating trauma and stress in the job. So alongside the more common sort of wellbeing provisions within an organisation like managers, peer support and EAP, we have other supports including chaplaincy, who provide pastoral care and some ceremonial support within the organisation. We have family violence support advisors who help staff who've experienced family violence or domestic violence in their homes. We have contact people who support staff who have experienced bullying and harassment. We have my team, which is the psychological health and wellbeing team, which is filled with our peer support advisors and our psychological health and wellbeing advisors. So a really amazing smorgasbord of opportunity for support within St John. We've seen it be really beneficial for people to have opportunity to link into the supports that they find most beneficial and connects with their need. So having different opportunities as opposed to one standardised practice means that those that don't like to see a chaplain or those that don't want to engage with peer support have other opportunities to get support if that's what they need. So I'm really passionate about healthy work design or mentally healthy work. And making sure those organisational factors like ensuring that the resourcing is adequate to the demand, that people have good rest and leave entitlements, that people feel that they're communicated to, it's fair, it's equitable. Those are the factors that really contribute to someone's psychological health or poor psychological health. So we need to consider those alongside the individual factors like resilience and mental health literacy. They're going to help that holistic support within the workforce.